Fragile X syndrome is an X-linked genetic disorder that causes progressive complications, including learning disabilities, cognitive impairment, and delayed development of speech and language. It is the most common form of inherited intellectual disability in males. Is also a significant cause of intellectual disability in females. It's usually identified by age 2, and males have mild to moderate intellectual disability, with about a third of affected females being intellectually disabled. Children may have anxiety and hyperactive behavior and attention deficit disorder. Many people often have autism spectrum disorder. This can affect their social behavior, communication, and ability to respond to social cues. Characteristic physical features include long and narrow face, large protruding ears, prominent jaw and forehead, unusually flexible fingers, flat feet, and enlarged testicles after puberty. Fragile X syndrome affects approximately 1 in 4,000 males and 1 in 8,000 females. Pan-ethnic carrier frequency is 1 in 250. Males with a full mutation only pass carrier status onto their daughters, since daughters have an unaffected X chromosome from their mother if the mother is unaffected. Since males inherit their X chromosome from their mother, they would be unaffected if their mother did not have the full mutation. Females with the mutation would be able to pass this full mutation on with a 50% chance that a child would be unaffected. Males are usually more severely affected by this disorder than females. This typical lifespan of affected individuals with Fragile X syndrome is largely normal. Many of them have an active lifestyle and good health, although they can have a number of medical problems, such as frequent ear infections, seizures, and even carriers are at increased risk for Fragile X-associated tremor and ataxia, which often has a delayed onset. There's infertility in females related to primary ovarian insufficiency, often leading to early menopause. So awareness of medical risks and increased monitoring is recommended. This syndrome is characterized by excessive CGG triplet repeats, so more than 200 on the FMR1 gene on the long arm of the X chromosome, which gives the appearance of being fragile and about to break. Mutations in the FMR1 gene cause Fragile X syndrome, and the FMR1 gene provides instructions for making a protein called FMRP, which is inactivated by the mutations. The protein helps to regulate production of other proteins and plays a role in the development of synapses, which are specialized connections between nerve cells. Diagnosing an FMR1 disorder, such as Fragile X syndrome, is established through the use of specialized molecular genetic testing to detect CGG trinucleotide repeat expansions in the 5-UTR of the FMR1 with an abnormal gene methylation for most alleles with over 200 repeats. So when you think about a interdisciplinary team to help with treating patients with Fragile X, you're going to want to include occupational therapy to improve motor skills. You're going to want to have psychologists or psychiatrists focus on behavioral issues, autism, anxiety. You're going to want to have physical therapy, work on joint issues and hypotonia. Neurology can assess for seizures. Gastroenterologists and nutritionists can assess infant feeding issues. ENTs and audiologists can manage the recurrent otitis media and associated hearing loss. And cardiologists can assess for mitral valve prolapse, which is common in the disorder. In terms of policy, improving funding for NIH research for gene therapies, long-term treatments, including protein synthesis and other possible drug treatments can have a significant impact. The Heads Up Act of 2019 would designate developmental and intellectual disability as a medically underserved population, expanding and improving medical services by increasing specialist availability through Medicaid and community health centers that are specific to that population. While this bill died in the 2019 session of Congress, it could be resubmitted for the current session with additional support from co-sponsors, medical organizations, and increased publicity. That is our presentation. Thank you so much for listening.